some people have said we need a whole new way of thinking about bioethics.
Really?
Yeah. And we gave that some serious thought as we considered this. And I thought, no, actually the fundamental principles that date from the Belmont Report, which was published in 1979, that was instigated by some really terrible research atrocities that occurred.
Like what? Tell me. Give me some history.
Like the Tuskegee Syphilis Study.
Really?
Very famous one where black men who had acquired syphilis were followed to study the normal course of the disease, even years, decades after it was known that penicillin would cure the disease.
So you're telling me, with clear knowledge and available medicine for the curing, these people continue to study these human beings longitudinally without even ever offering anything.
And without ever even telling them.
Yeah, that's a travesty.
And there were lots of examples of that. And the reasons in the 60s and 70s, it's hard to put yourself back there, but people were so excited about the advances in science that happened then, that seemed to be the overriding value when we talk about conflicting values. And of course there was racism and all kinds of other things at play. But there were lots of other examples. There was an example at the Willowbrook Institution, which was an institution for developmentally disabled children, where they followed kids who got hepatitis because it was endemic, it was catching. And didn't tell their parents, didn't inform anybody about it, but out of that developed eventually a hepatitis vaccine. So they thought, that's what they were aiming at. They weren't thinking about who are these human beings.
Well, that seems like an excuse.
Well, it was a different way of thinking.
It sure was.
It was wrong. No doubt about it. The National Academy and the U.S. government put together a national commission on research protection of research subjects that came out with this Belmont Report that stipulated the three principles of respect, beneficence, and justice. Those are the three principles. And out of that came all kinds of regulations that now people take for granted in medicine. It was originally designed for research, but actually is applied in clinical care too.